Hello and Assalamu alaikum. Ultrascan Diagnostics said this is the CBCT of the patient that you had requested. The area of interest is the upper right and the lower right 4, 5, 6, 7 region. This is the upper right 4 region. We go to the transaxial view. As you can see, very thin ridge, no bone for implant placement. Then we move on to the 5 region. Again, very limited bone here. There's 5 millimeters of ridge width with 8 millimeters of height. Moving to the upper right 6 region, we've got a BDR. If this is extracted, we've got a ridge width of 11 millimeters and a height of just 4 millimeters, and very severe sinusitis can be seen right here. So implant placement until proper bone augmentation is done in the upper jaw, upper right side implant placement cannot be done. Moving to the lower right region, this is the anterior abutment of the 3 unit. Looks absolutely fine, no pathologies. So then we move on to the lower right 6 region. We've got D3 quality bone, 7 millimeters of ridge width with 14 millimeters of height. And then let's move on to the distal abutment of the 7, severely cavitated underneath the bridge. If this tooth is to be extracted, we've got a ridge width and a bone quality of D1, ridge width of 12 millimeters and a height of 10 millimeters. This is the upper left 4. We've got 5 millimeters of width with 11 millimeters of height. Um, the lower left, as you can very clearly see, we've got multiple missing teeth in the anterior region of the bridge, and then we've got a 6 missing, which is distal to the pair abutment. Here we have approximately 6 millimeters of width with 12 millimeters of height.